Kinetic Hair Transplant Clinic. Myself, Dr. Ravi Khare. I'm a maxillofacial cosmetic surgeon. So today the topic of the discussion is shading phase after hair transplant. So what is a hair transplant? So I'll tell you in detail what is a hair transplant. So once the surgery is done, after that there's for the 7 days we take medication, we take proper care, spray, creams and everything. So after that there like after from the surgery, from the day of the surgery, for 15 to 20 days, yeah, you will notice all your hair the transplanted. If the surgery is done good, if surgery is done by the expert surgeon, a qualified surgeon, then you will feel all your hair, you will see all your hair, a thick hair and everything for 15 to 20 days. Enjoy that moment, because you're gonna last for only 20 days after hair transplant. And after that, like, that happiness comes, like when you see your all hairs, like it was the phase for the baldness during the young phase of your life, and then you will, after hair transplant, you are very happy, you see all your hair and everything, and the patient is very happy. Then suddenly after 20 days they start noticing shading of the hair. So they get panicked, they think like, I was waited for this long for the surgery to get my hair back, and now then again shading phase is going on, whether my surgery was done by the, like, it was properly done, or is there any problem with me? So there are many questions, so that's why I'm gonna answer you. So what happened, there are three phases of the hair. First is anagen phase, then there is a catagen phase, then there is a telogen phase. So anagen phase means healthy phase. In this phase hairs keep growing, okay, and they're fixed, like it lasts for 3 to 5 years, may vary. So in this phase the hairs are keep gonna growing, they are gonna be there, they are not gonna shed, okay. So hair keep growing, they are in a very healthy phase. Then there is a catagen phase, which is a resting phase. It lasts from 0 to 2 years, and in this phase the hairs are resting, okay. And then there is a telogen phase, that is the shading phase. The hair shade, it like it become old, it shade, and there is a new hair comes in the place of the old hair. So when we do the hair transplant surgery, the assume this hair was in the anagen phase, okay. So anagen phase, as I already told you, lasts for years, and then it was going through the anagen phase. Then I have pull it, okay. Once I have pull it, the anagen phase has stopped, then I have transplanted in the another region. So anagen phase has stopped, then there will be the resting phase for 15 to 20 days, then there is a telogen phase is gonna come. This is the cycle, this is the steps, okay. Anagen, catagen, telogen. Then telogen phase come and hair sheds, okay. So it is a very natural phenomena, you don't have to worry. If the surgery is done by the surgeon, then it's gonna shade completely. It may vary, the percentage of the shading may vary. Some might feel that 10% hairs are only shading, some might feel the 100% hairs are shading. So it may vary according to the patient and patient, okay. It's depend on the phase also. If the hair was in the telogen phase, gonna shade early. If hair was in anagen phase, you're gonna last for 15-20 days. But shading is compulsory, it's inevitable, okay. That's the part of the process of the hair transplant. So there are two things happening in this. One is the shock loss and one is shedding phase. So what is shock loss? Shock loss is when we operate in certain area, they were already good hair, okay. They were in their anagen phase or any phase, and like we have transplanted one hair. So this was a hair, a natural hair, and we have transplanted this hair. So it's depend on the surgeon, a good knowledge and everything, that how much gap should there be between two hairs, anatomical gap, physiological gap. It should be ideal. It's not about the very much density, I'll get a good result. If you are going for a very much density just because they are getting money for per graft, so you might see the result for very few time, 2 to 3 years only, and after that again you will be the bald for the lifetime. So there should be a good healthy gap between two hair, so they could survive. Otherwise one hair will grow, one won't, or two, both hair will become thin, or both will die, or both might sustain if there is a good gap in between the hair. So shock loss is because of the injury, is because of the work procedure, is because of the operating area in that region. So because of the injury and the process, the good hair, it injury and everything, the nourishment stop, the blood supply stops, or it hamper, and because of that thing the hair becomes thin and the shock loss happens. So natural hair also keeps shedding. It happens in both transplanted and donor area also. Okay, so natural hair keeps shedding, and the shedding phase is like transplanted hair. It's for the transplanted hair and they shed. So shedding phase you will see after 15 to 20 days after the surgery, and it's gonna last for 3 or 4 months max. After that there will be the again anagen phase. So don't worry about the shedding phase. Shedding phase is a very normal thing. Each and every patient, like I have done thousands of patients, but each and every patient I tell them same thing, that you're gonna experience the shedding phase from 20 days to 3 months. But they keep coming back to me and they keep asking the same question, whether I'm not gonna get my hair back or not, whether I'm healthy or not, whether my surgery was done properly or not, why I'm facing this issue. So these problems are perfectly fine, because it's a human nature. Human keeps thinking, and when it's a hair transplant they little bit overthink. So don't worry, once the shedding phase is gone, that's why we use minoxidil and the other medication to promote your anagen phase. Okay, so first step first, there is anagen phase, we extracted the graft, then anagen phase has stopped, then we had transplanted it. So because of the transplantation the natural hair was there, assume if there is a natural hair, and we have transplanted another hair. So because of this thing the shock loss happen, and because of shock loss happen the natural hair is gonna shed, and this hair is already gonna shed because its anagen phase has stopped. Okay, so there will be the shock loss and the shedding. After there will be the shedding after hair transplant. It's gonna last for 3 to 4 months, and after that again you will start seeing result, and there will be the PRP after 3 months, 1 month 1 PRP or 2 PRP, depends on the surgeon, and on 6 to 7 months you are gonna see your result. So this was my video about the shedding phase after hair transplant. I kept it in the brief and the easy way. Hope you like it, and if you have any other questions do ask me. Thank you.